Hello, welcome to Medgre's video tutorial on checking in a new patient. We are going to check in a new patient for whom an appointment has already been created in the application. Check-in confirms the patient's arrival at the clinic on the date of the appointment. You must check in a patient who is physically present at the clinic on the date of the appointment. Please note, check-in cannot be done for a future date of appointment. To check in a new patient, we first locate the patient details and then fill in information for demographics, preferences, and insurance. Let us get started now. This is the home page of the Medgre application, and we are in the dashboard section. The dashboard displays the list of appointments for the current day. We will now search for the patient whom we need to check in. In the Scheduler widget, let us click on the calendar control to select the dates of the appointment. Now, enter the first name or last name or chart number of the patient in the search field. Then click Search. Do you now see the appointment details for the relevant patient being displayed? We may also see other patients with a similar first name being displayed. Okay, now click Check-in against the relevant patient. The check-in pop-up displays the appropriate process. After you have read it, click Continue. We are now in the patient's chart, and patient's demographic is displayed as default. Prior to entering demographics, let us get to know certain details. The fields marked with a red asterisk are mandatory, for example, chart number. Certain fields are pre-populated. The details have already been entered by the user while creating a new patient, for example, first name. You may edit the details if needed. A few fields need entries to be picked from a drop-down list, for example, yearly income. Certain fields accept only numeric entries, for example, home. This is the home phone number of the patient. A field such as date requires us to click the provided control to select a value. While these sections pertain to the patient, the responsible party section seeks information related to the patient's guardian. You may want to enter details here in case the patient's contact need to be informed when there is an emergency. As the employer's details are self-explanatory, let us now enter the needed information. We need to click Save to save the details. Please note, do not click Cancel unless you want to discard the entries. Okay, let us click Save now. If mandatory information is not filled, the application displays an error. Fill in the details before clicking Save again. The application prompts you with the message to confirm the action. Click OK. Do you notice this checkbox being selected? It is automatic so as to indicate the completion of the demographic details. Let us now enter preferences. You may select preferences from the left menu or by clicking Preferences from this banner. To enter the relevant data, click Edit. You may use the drop-down list to select a value and click to select a checkbox to indicate the preference. The passcode is needed only when the patient and the patient's family need information over the phone. Then they need to state the passcode. You may reset a passcode by clicking this button. Besides, a patient may need access to the patient portal. Click this checkbox to enable the portal and set a date to indicate the start date of access. Click the Update button to save the preferences details. Notice that the checkbox next to Preferences is automatically selected. Let us now complete the insurance details. You may select insurance from the left menu or by clicking Insurance from this banner. Click the Primary Insurance tab. We will enter the mandatory information. In case you want to upload a scanned copy of the insurance card, click Browse. Similarly, you may enter details in the other two tabs. Then, to record the data, we need to save the information. click Save. Do you notice the active insurance and past insurance details are displayed at the bottom of the insurance window? The checkbox next to insurance is automatically selected. Now that the details of demographics, preferences, and insurance have been entered, we need to complete the process. To do that, click Done. Though you may click Done without completing details, it is not advisable. On clicking Done, a pop-up is displayed to assign a room. Click Add New to select and assign a room. Click the Continue button to complete the room assignment and check-in process. The dashboard is displayed. The status of the patient's appointment is changed to screening. In this video, you learned to check in a new patient. While checking in a new patient, we completed details for demographics, preferences, insurance, and also assigned a room. Thank you for watching the video tutorial.